The culture of microorganisms from blood is critical in the laboratory diagnosis of bacteremia and fungemia, in order to manage patients with many infective conditions associated with a clinical presentation of pyrexia of unknown origin. Blood culture plays an integral role in the evaluation of sepsis, and it is therefore essential that the blood culture procedure is carried out in a timely manner using an aseptic non-touch technique, ANTT, to avoid contamination of the specimen and to carry out 2 separate stab tests, one after the other. Blood cultures should only be carried out by staff members properly trained in the procedure and whose competence in blood culture collection has been validated. Microorganisms are present on the skin surface of patients, staff, and the immediate patient environment and could easily contaminate specimens. Coagulase-negative staphylococci are the commonest blood culture skin contaminant, and therefore proper cleaning of the skin is a vital component of venesection and aids in the prevention of false positive results. These results can cause confusion due to the difficulty in determining if a positive blood culture is due to a genuine pathogen or due to contamination of the specimen. Contaminated blood cultures may compromise patient care by prolonging their hospital stay and exposing them to unnecessary antibiotic therapy. It also leads to needless engagement of clinicians, laboratory, and microbiologists' time and unnecessary repeated cultures. Although it has been recommended that the target rates for blood culture contamination should not exceed 3%, the contamination rate for many institutions actually exceeds 7%, with up to 50% of positive blood cultures being false positives. A study carried out in Antrim from 2007 to 2008 found that 4.7% of blood cultures were contaminated and that false positive results added 1,372 hospital days and incurred detrimental additional hospital costs of £1.3 million per year. The Northern Health and Social Care Trust Blood Culture Policy for Adults adheres to the Department of Health Summary of Best Practice 2007 and must be followed at all times. Staff will only take blood cultures if there is a clinical suspicion of the presence of infection and not as routine, when they are competent and trained, and they can maintain asepsis throughout the procedure. You must ensure that you are compliant with the full policy document. If you're ever in any doubt about an element of this procedure, remember to refer to the full policy document and that a clinical microbiologist service is available.